Greetings everyone, this is Dr. Abhishek Samdesi and today we'll be discussing regarding ABG Simplified Part 8, Respiratory Alkalosis. So in this we shall discuss regarding the definition, the etiology, the clinical manifestation as well as interpretation of respiratory alkalosis. So when do we call respiratory alkalosis? We call it respiratory alkalosis when the carbon dioxide in the arterial blood is less than 35 mmHg associated with increase in pH. This is called as respiratory alkalosis. So let us have a look at the mechanism. The mechanism is due to hyperventilation. Whenever a patient has hyperventilation, the carbon dioxide that is there in the lung gets flushed out. When carbon dioxide is flushed out from the alveoli, the carbon dioxide level in the blood decreases. This results in increase in pH, which is respiratory alkalosis, as this is mediated by the lung. Now let us have a look at the causes of respiratory alkalosis. All the causes of respiratory alkalosis are going to cause the patient to hyperventilate. So let us have a look at the causes. The causes can be central causes such as pain, anxiety, psychosis or fever. The other cause can be factors that results in hypoxemia such as high altitude, pneumonia, pulmonary edema, aspiration and even in case of severe anemia. The physiological factors such as pregnancy, also other factors such as septicemia, heat exposure and recovery from metabolic acidosis. Hyperventilation also occurs because of stimulation of chest receptors as in case of hemothorax, flail chest, cardiac failure or pulmonary embolism. So these are the causes that results in hyperventilation, which in turn reduces the carbon dioxide level in the blood, resulting in respiratory alkalosis. Let us have a look at what effect the respiratory alkalosis has on the body. So these are the clinical manifestation. As previously discussed in metabolic alkalosis, whenever there is alkalosis, it mainly affects the electrolytes, resulting in hypokalemia and hypocalcemia. So these are the following clinical manifestation. The first one being the carpopedal spasm and weakness. These are because of the electrolyte imbalance. The other manifestation are the CNS manifestation, such as increased neuromuscular excitability, which is paresthesia, and dizziness, mental confusion, syncope and seizures. These features are due to cerebral vasoconstriction. Now let us have a look regarding the compensation in respiratory alkalosis. As discussed in the other video, whenever we are dealing with respiratory component, you will have both acute compensation and chronic compensation. Here, the acute compensation is given by the formula where the predicted decrease in bicarbonate is equal to 0.2 into reduction in the carbon dioxide. This is suggestive of an acute event. A chronic compensation is given by reduction in bicarbonate is equal to 0.4 into reduction in carbon dioxide. So what is happening here is, whenever your carbon dioxide is on the lower side, your bicarbonates in the body reduces so as to compensate for the alkalosis. So these are the equations to assess if patient has acute or chronic compensation. Let us discuss regarding the interpretation of respiratory alkalosis. Let us have a look at the first scenario. In this first scenario, what we see is there is reduction in carbon dioxide. And when we note the pH is within the normal range of 7.40 to 7.45. Despite the pH being within the normal range of 7.40 to 7.45, it is more than 7.40. So it is on an increasing trend. The bicarbonate is still normal. So this is suggestive of an acute event. Now let's look at the second scenario. In this scenario, what has happened is the carbon dioxide is reduced and the pH has gone out of the normal range. It is more than 7.45. As you note here, the arrows are in opposite direction. Because this is alkalosis and carbon dioxide is involved, this is respiratory alkalosis. But what we are seeing with the bicarbonate is it is still within the normal limits. So it is not taken part in the compensation yet. So this is a uncompensated respiratory alkalosis. Now let's have a look at the other scenario. In this particular scenario, the carbon dioxide levels are reduced and the pH is out of the normal range. It is more than 7.45. But what we see is the bicarbonate also is reduced. So the bicarbonate has taken part in compensation, despite which the pH is not come within the normal range. So this is a partial compensation of respiratory alkalosis. Let's look at the final scenario. In this scenario, we note that the carbon dioxide is reduced and even the bicarbonate is reduced, because of which the pH has come within the normal range. So this means that the compensation is complete. It is a fully compensated respiratory alkalosis. So this brings an end to the interpretation of respiratory alkalosis. These are my references. Thank you for watching.